My name is Jessica, and I will be your nurse today. I will be performing a head-to-toe assessment. Can you just tell me your name and your birth date?
Tiffany Burgess, June 20th, 1994.
And do you have any allergies to any medicines? All right. I'm going to go ahead and perform hand hygiene. And I'm going to get your vital signs. Okay. Your blood pressure is 104/70. And that is a really good blood pressure for your age. Next, I'm going to check your pulse. Okay, your 30-second pulse is 40, so your 60-second pulse is 80, and that is within normal range. A normal heart rate is between 60 and 100. If you could go ahead and step up on the scale for me. Okay, it reads 115, is that correct?
Yes.
All right, you can have a seat. And how tall are you?
5'1".
5'1", all right. So her weight is 115 pounds, and she is 5'1". All right. So now we're going to go ahead and start our assessment. We're going to first start with the skin, hair, and the nails. Okay? All right. So first of all, I'm just going to inspect. I'm going to look at you from head to toe before I do any touching or listening. And just looking at you, your skin looks well groomed. It's nice and moist and shiny. I don't see any lesions or any rashes. I don't see any edema or swelling noted to any parts of your skin. Can you stick out your nails for me? All right. I'm going to test your capillary refill, which is making sure that you're being well hydrated. Your body is perfusing very well. And your capillary refills are brisk, less than 2 to 3 seconds. Your nails are very clean and well groomed. I don't see any cyanosis or clubbing to your fingers. Your skin is very elastic and tight. It is not loose. And now I'm going to look at your head. Can you tilt your chin down? Your scalp looks really clean. I don't see any areas of dryness. Okay, you can sit back up. Now I'm going to inspect your temporal artery. And I'm going to do that by touching first. And I'm going to listen second. The temporal artery is nice and bounding. I'm going to listen with my stethoscope using the bell. And when we check using things like a buoy, we listen for abnormal sounds using the bell of the stethoscope. No bruits were noted upon auscultation. Next, I'm going to inspect your thyroid gland. The thyroid is noted to be midline, no lumps or anything noted in the throat. I'm also going to listen to the thyroid for any bruise as well using the bell of my stethoscope. If I were to hear a bruise in your thyroid area, it may indicate that you might have a thyroid condition, and you would just have to follow up with someone in regards to that. And no bruise was noted while listening to thyroid gland. Also, I'm going to get you to lift your neck up, and I'm looking at the trachea. The trachea is noted to be midline. Can you just swallow for me? Good. Also, I'm going to assess your carotid arteries and your jugular veins on both sides. Just tilt your head to the side. You want the jugular vein. I'm going to palpate your carotid artery. Okay. I'm going to do the same thing for the other side. See the jugular vein there, and then I'm palpating the carotid artery. And your carotid artery is noted to be nice and bounding, okay? Next, we're going to inspect your lymph nodes. When we look at your lymph nodes, we do not want them to be felt. We don't want to feel your lymph nodes because that may indicate that you may have an infection somewhere, okay? First, we're going to start with the pre-auricular lymph node. Then we're going to go to the post-auricular. Then we're going to go to the retropharyngeal. Then we're going to go to the occipital, which is behind the ears. Then we're going to go to the submandibular, which is more towards the front of the chin. Then we're going to go towards the submental, which is under the chin but more towards the back. Then we're going to go to the superficial cervical chain. Then we're going to go to the deep cervical chain, which is towards the back of the neck. And then the supraclavicular lymph node, which is the clavicle area. And no lymph nodes were palpated. Alright, next we're going to go to and look at your eyes, ears, and your nose. Your eyes are clear. Your conjunctiva is clear. We're going to do the 6 cardinal field of gaze. And what that is, I want you to look at my pen light, and wherever, I don't want you to move your head, but I want you to follow my pen light whichever way I go. And this is using the H method. And while assessing the 6 cardinal fields of gaze, there was no nystagmus or irregular eye movements noted. Next, we're going to get you to stand. And we're going to test the visual acuity using the Snellen chart. We're going to get you to put your hand over put the card over your left eye and read as far down as you can.
E, F, P, T, O, Z, P, D, C, L, P, E, D, P, E, C, F, D.
Okay. And then we're going to get you to do it on the right.
E, F, P, T, O, Z, P, D, C, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P.
And then we're going to get you to do it with both eyes.
E, F, P, T, O, Z, P, D, C, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D.
Okay. Have a seat. And next, we're going to get you to do the near vision card. Reading. Keep it in a close distance.
EP, EOP, DTL, CDF, TDPCF, ZOEL, DZEL, CFOTP.
Awesome. So with the distance vision, when we use the Snellen chart, we do the right eye, the left eye, and then we do both eyes. The right eye, how far you go from top to bottom, that determines whether you have 20/20 vision, 20/30 vision. The first number is for the left eye, and then the second number is for the right eye, or vice versa, whichever number that you do first. And you did very well on that. Next, I'm going to look at your ears. Your ears are noted to be symmetrical. No debris noted in your ears. Bilaterally. The skin tone on your ears are within normal limits. They're not discolored. There are no lesions on your ears. There are no keloids on the back of your ears. No abnormal findings noted. I'm also going to check your nose. Your nose appears to be symmetrical on both sides. No deviation noted. I'm going to get you to occlude the right side of your nose and then take a sniff in. And your nose is noted to be patent on the right side, and then I'm going to get you to do the same thing on your left side. And your nose is noted to be patent on that side as well. Next, I'm going to look in your mouth. I'm going to get you to say ah for me. Ah. Stick out your tongue. Say ah.
Ah.
Your uvula is noted to be midline. Your buccal mucosa is nice and moist. Your tongue is nice and beefy. No lesions noted on your tongue. No lesions noted inside of your mouth. Your teeth are nice and straight. Your gums are nice and pink. Your lips are moist. They're not dry. Dry lips could be a sign of dehydration. Okay. Next, we're going to listen. I'm going to listen to your lung sounds. Okay. I'm going to listen to them using the diaphragm of my stethoscope. I'm going to note your tracheal position, which is midline. Your chest wall is symmetrical for a 19-year-old. And then I'm going to place my stethoscope on the front areas, on the back areas, 4 points. I'm going to test your upper bases and your lower bases, and then I'm going to assess both sides laterally on the right and the left. And then I'm just going to get you to take deep breaths in, breathe out through your mouth, okay? And again, I'm going to use the diaphragm of my stethoscope. Take a deep breath. Deep breath. Deep breath. Deep breath. Deep breath. And then deep breath. And deep breath. The chest rises and falls symmetrically. The breath sounds are noted to be clear and equal. Respirations are regular and unlabored, and no signs of respiratory distress are noted. Next, we're going to listen to your heart sounds. We have 5 different areas that we're going to listen to. First, I'm going to listen to the areas with my diaphragm with the stethoscope, and then secondly, I'm going to listen to the areas using the bell of my stethoscope to assess for any abnormal heart sounds. The first area is the apex of the heart. It's the right substernal border, second intercostal space to the apex of the heart. Second area is the second intercostal space, is the pulmonic left sternum border. And then the third space is the Erb's point. It is the midway point to where you can listen to murmurs. It is the third intercostal space to the left of the sternum. Then the tricuspid. It is the fourth intercostal space, left sternum border. The fifth area is the fifth intercostal space, left mid-clavicular line at the cardiac apex of the heart. And then I'm going to change it over to the diaphragm of my stethoscope. You can just breathe normal. Now I'm going to switch over to Bell side of my stethoscope to listen for any abnormal heart sounds such as S1, S2, and brewing. I'm sorry, S3 and S4 and brewing. Next, I'm going to listen to your carotids for any bruits. And while I was assessing her heart sounds, she had normal S1, S2, no extra heart sounds were noted, and no bruit was noted. And I'll get you to hold your breath while I listen, and I'm just going to listen on different areas of the carotid artery. Take a deep breath and hold it. Okay. Just turn your head to the side. Take a deep breath and hold it. Awesome. You're doing a great job. Do you have any questions? No? Okay. Before we move on, I'm going to talk to you about breast exams. Is there anyone in your family that has ever been diagnosed with breast cancer?
Mm-hmm.
Yes. Okay. So you are 19 years old.
Mm-hmm.
Do you do self-breast exams now? Okay. So the importance of doing self-breast exams early is that you begin to identify with your breasts. You begin to know them and learn them, and if you have any changes, you can always call your physician and say, hey, something's not right, because you know your body. The recommendation is that women starting at the age of 40 is when you're supposed to get a mammogram. But if you have genetic predispositions such as your mom had breast cancer, your sister had breast cancer, researchers say that you may need to have breast exams done earlier. And you may not have to have a mammogram, but they may recommend you getting an MRI done, okay? So the importance of doing, like I said before, self-breast exams is just knowing what your breasts look like. So I'm going to demonstrate to you how to examine your breasts when doing a self-breast exam, and then I want you to return the demonstration back to me. Okay? You're going to start with your hands up, And it's best to do this while looking in the mirror. And you're going to start from the outside of the breast. It's best to kind of start from under the arm because it's always good to feel for lumps under your arms as well. And begin to work your way around the breast in a circular motion all the way around until you reach the nipple. And when you're feeling for your breast, make sure that you're touching to where you can feel and see if you have any lumps. Some women have what is called a fibrous breast, where their breasts are naturally lumpy. So that is why it's very important for those women to know what their breasts feel like, know what it means to have a fibrous breast, and know what it means to have something abnormal and out of place. And also making sure you're going to your annual checkups when you go to the doctor and have them actually look at your breast. So once you've palpated your breast or touched your breast and inspected them, then you can squeeze your nipple to make sure that you don't expel out any milk or any type of fluids. And then also when you're looking at your breast, you want to make sure that your nipples aren't inverted, that they are still protruding from the skin. Okay? Do you have any questions? Well, I want you to return demonstration to me what we just talked about.
You raise your hand, start up under the arm, feel, and do a circular motion around your boob until you reach the nipple. And then you squeeze the nipple for any milky or liquids.
Okay, Doc. Do you have any questions? And the best time to examine your breast is within 7 days after your menstrual cycle. Okay? So moving on, I'm going to have you flat on your back. Okay. I'm going to check for edema in your lower extremities, and I'm also going to check the peripheral pulses. I'm looking at her lower extremities. Her feet are very cold, but her capillary refill is brisk and less than 2 to 3 seconds. I'm going to check for edema by pressing both of my hands into her lower extremities. And when I say edema, I mean swelling. We look for what we call pitting edema, and there is no edema noted. And what we do is we press our first 2 fingers into the skin, and if it leaves an imprint of our fingers, that means that the patient has pitting edema, but you do not have any pitting edema. So I'm going to check for our pulses, starting with the dorsalis pedis. And our pulses are bounding. And when I'm checking for the dorsalis pedis pulse, I'm placing my hand on the top of the foot and palpating the pulse. For the popliteal pulse, I'm placing my hand on the inside of the ankle and I'm palpating. Our pulses are noted to be bounding. I'm going to work my way up, and I'm going to palpate under the knee, which is the posterior tibial. And then I'm going to do the same thing on the left side. Okay, and pulses are noted to be bounding bilaterally on the posterior aspect as well. Then I'm going to check the radial pulse. On the right and the left side bilaterally. And then we're going to have you sit up. I'm going to check the brachial pulse. Swing your feet back around the bed. All pulses were normal. They were bounding. No 30 or weak pulses noted. Okay, now we're going to move on to our neurological part of the assessment. Your Glasgow Coma scale was a 15 because your eyes are open. Can you close your eyes and open them?
Mm-hmm.
Good. You respond to my voice, and then your motor response. You were able to lift up your legs when I asked you to, so that gives you a Glasgow Coma scale of 15. The first cranial nerve is the olfactory nerve, which is the sense of smell. I'm going to have you smell fingernail polish. And do you smell that?
Mm-hmm.
Okay. The second cranial nerve is the optic nerve, and that is vision. You looked at the board, you can see me. As stated earlier, you say you wear contacts. The third cranial nerve is oculomotor. We already assessed that when we did the 6 cardinal field of gaze. And 3, 4, and 6 are our extraocular cranial nerves. That's what we test. We test the extraocular movements of the eyes. It's the visual cranial nerves. The number 4 is the trochlear cranial nerve. We test for the eye movement. No nystagmus was noted. No extra twitching of the eyes was noted during that. Number 5 is the trigeminal nerve. When I assessed her level of consciousness and I asked her to open her eyes and close them, she was able to do so. Number 6 is the abducens cranial nerve. And I'm going to ask you to close your eyes. Do you feel me touching?
Oh.
Do you feel me touching?
Mm-hmm.
Where did you feel it?
My cheeks.
Awesome. The abducens cranial nerve is intact, number 6. Number 7 is the facial nerve. Are you able to raise your eyebrows for me? And puff out your cheeks? Awesome. Number 7, the cranial nerve is intact. Number 8, the acoustic nerve is the whisper test.
Yeah. Mm-hmm.
The cranial nerve, number 8, the acoustic nerve is intact. Number 9 is the glossopharyngeal. And number 10 is the vagus cranial nerve, and that's when we test the gag and swallow reflex. So I'm going to have her swallow some water. Alright. Number 11 is the accessory muscles. I'm going to get you to turn your head from left to right. And then take your chin and raise it back up. Then I'm going to get you to turn your head to the right, to the left, up against my hand. Good. And then the same side. Good. She was able to press against my hands with resistance, and that is testing the sternocleidomastoid muscles that are intact. And then number 12, cranial nerve number 12, the hypoglossal is the movement and strength of the tongue. Are you able to stick out your tongue? Awesome. All cranial nerves are intact. Next assessment that we're going to do is the muscles. Can you raise your shoulders up and raise them down? And then raise them up against my hand. And then put them down. Good. And then we're going to test the reflexes. I'm going to test the reflexes by hitting the areas with my diaphragm and my stethoscope, just to make sure that she has reaction. I'm going to tap her leg. And then I'm going to tap here.
Mm-hmm.
And then I'm going to tap on the arm. Awesome. Also, I'm going to palpate the temporomandibular joint. I'm going to check for TMJ. I'm going to get you to open your mouth. Close it. Alright, no signs of TMJ noted. Also, we're going to get you to stand. I want you to hold out both hands. Close your eyes. We're going to check for, hold them all the way out. There you go. Close your eyes. We're going to have you hold them, close your eyes, and we're going to check for pronatal drift. Okay? No signs of drifting or noted. And have a seat. And then I want you to lay down for me. Awesome. Now we're going to test for muscle strength. I want you to push up against my hands. And then when I pull up against your feet, I want you to pull up against my hands. Good job. You have good muscle strength in the lower extremities. And then I want you to grip my first two fingers with your hands. Good. The patient has good strength, equal on equal sides, and she has good strength in the bilateral lower extremities on equal sides. And then I'm going to have you lay down, and we're going to do an abdominal assessment. First, I'm going to auscultate your abdomen, which means I'm going to listen. I'm going to inspect, and then I'm going to listen with the diaphragm of my stethoscope. I'm going to listen to all 4 quadrants. All 4 quadrants are active. The patient has active bowel sounds in all 4 quadrants. Now we're going to test for vascular breweries in the abdomen. The renal is the bilateral upper abdomen. The aortic is the middle of the abdomen above the umbilicus. And then the iliac is the lower quadrants bilaterally. And I'm going to listen using the bell of the stethoscope. No abnormal sounds were noted while listening. No brewing was noted while listening to the abdomen as well. I'm going to have the patient sit up for me. Do you have any questions? All right. This concludes my assessment. Thank you.